The GHA has set up a specific number for this service to be requested, which will be available during normal working hours, and there is a voicemail callback facility outside of normal working hours. And there will be other safeguards internally to make sure that confidentiality is protected and the information doesn't have to be shared within the GHA if the patient doesn't wish it to be. So they will be given the option.
And there's been a lot of criticism when it comes to Gibraltar's mental health provisions, which is obviously hugely important when it comes to abortion. How will you ensure this will be adequately provided for?
Mental health support is an integral part of the pathways and of the GHA's framework when it comes to abortion. And an offer of an appointment with a member of the team from the GHA Mental Health Services will be offered at the very first opportunity, at the first consultation, and will be made available throughout. In the event that someone wants to continue and have an abortion, will be made available to them throughout the process, before and after as well.
And with the GHA often seeing long waiting lists, how will you ensure abortions are carried out in a timely manner?
The framework provides for a time frame and dates by which abortions have to be carried out. So there is a specific time frame for this. This is not a standard procedure as other standard procedures. It has its own framework, its own guidelines and its own deadlines.
Given the provision for conscientious objectors, can the GHA confirm there will be enough doctors to perform this service?
Yes, and the doctors within the GHA have all undergone the training, and insofar as the doctors who would be performing the service, there has been no reports that anyone will choose to opt out.
And it's not been that long since the referendum, and it seems that things have been put into motion pretty quickly.
Well, we had to be ready in the event that the referendum went the way that it did. There was obviously a time limit by which we had to bring the legislation into force, so I wanted to make sure that we were ready and prepared well ahead of time.